All right, so today we have quiz one. So before we start, does anybody have any questions? No questions. All right. So just a reminder to make sure that your name is on your device that you signed in with. All right, so let's keep a couple people still coming in. All right, so we will start with the quiz. I'm going to put the password for the quiz will be in the chat. It is 10 questions. You have 15 minutes to take the quiz. And you may turn your cameras off when you are done. And then once everybody is done, we will get on with today's lecture. So good luck with your quiz. Password is in the chat. Karima, you need to turn your camera on. No, I don't know where she went. Miriam, Miriam, I'm gonna pull you into a breakout room,
Huh?
okay?
Yes.
Give me 1 second. All right, everybody. All right, so good job on your quizzes. If there's any questions about the quiz, you can stay on after, and we can go through any questions that you may have on the quiz. But you guys did well. So good job on quiz one. Um, so we're gonna jump into the lecture for today. So one thing I did, and I apologize, but I did open up your I can't even say the word. I did open up your vulnerable populations project. Um, and so I'm going to go through, I knew there was a couple people that had some questions about the vulnerable population project that is due. And so I want to just kind of just go over that really quick. I'm not going to spend a whole lot of time on it. Um, we can answer questions. We do have quite a bit of information to cover today. So with your vulnerable population project, you're going to pick a vulnerable population. Um, and so as we go through community, obviously you're going to learn a lot more about vulnerable populations. But this could be homeless population, it could be you pregnant adolescents, it could be migrant workers or immigrants, the elderly, children, um, your HIV population. So there's a number of different vulnerable populations out there that you're going to you can pick from. But the purpose of the vulnerable population project is to look at the area that you are living in. All right. Um, you're going to do what's called a windshield survey. All right. And a windshield survey is basically looking at, driving around your community and looking at your windshield and looking at what is in your area. Do you have a high homeless population? Are there a lot of migrant workers in your area? Do you have a large veteran population that's also considered a vulnerable population? Um, is there a lot of, mentally ill, drug users, whatever you have in your particular area. Um, and so that windshield survey, you go within the city limits, right? So whatever city that you live in, you want to make sure when you're looking at the area that you're just within that city. Um, and so you're going to identify a vulnerable population, and then you're going to make a PowerPoint presentation. All right. And so you're going to do your statistical information, your demographic information. Okay. This is for the whole city. This isn't like, so, trying to think of, let's see, if I go, let me look and see where some of y'all are from. So, a lot of Ohio, okay, in this class, and Pennsylvania and Richmond. So, if as you're driving around the city that you're living, what's the population of the area? So let's say, I don't know how big Centerville is, I don't know how big Essington is, okay, but let's just say your population's, 100,000 people, okay? And you're going to do the demographic information for that area. So the total number of people, what are the age ranges of the people in your area, the ethnicities, the gender mix, what are the more popular religions, that kind of thing. And then what's the, rate of homelessness, how many are veterans, whatever your population that you're picking. With that population, what are their risks? What are their health risks? So you want to talk about the health risks of that population. Then you want to identify the health needs of the population. So I'm just going to say the homeless population, okay? I'm just going to use that because it's just general, right? We know that they have exposure to the elements. They obviously are going to have food insecurity. They are not going to get treatment for chronic diseases, right? So those are not all, but some of the health risks that we would see with the homeless population. So what are the health needs, right? Immunizations, access to free clinics, food banks, shelter, right? So identifying what their health needs. And then you're going to look at your community and identify what the resources are in your community. And this is where the rubric is going to be really important. So you need to identify 8 to 10 resources that are present in your community that work with your vulnerable population that you chose, right? So the homeless population, are there shelters? Are there food banks? Are there free clinics, immunization, mobile immunization units, whatever you may have with, even churches, things like that. And then you're going to assign those to a prevention. So you want to identify at least one primary prevention measure that within those resources that are available to you, to that population in your area. And then you want to identify a gap. All right. So maybe they don't have, you know, mobile immunization clinics, or maybe there isn't a free medical clinic. You want to identify a gap that is not, or a resource that is not available in your area. And then you're going to, just say like, hey, I think, a free clinic would be, a good idea. And here's why. How would that impact that vulnerable population? So it's not, it's gonna help you to get to know the area that you are in. So when you're preparing your PowerPoint slide, you're going to have your title slide. Then you are going to have a minimum of one, two, three, 4 PowerPoint slides as your content, and then your reference slide. So it's going to be a minimum of 6 PowerPoint slides. It can be more depending on how much information you need to put in there, and then you will submit it. Um, we can, as we go through, we're going to learn more about vulnerable populations and windshield surveys and things like that. But just wanted to give you kind of a small breakdown, so that you can at least have an idea, of what the project entails. Does anybody have any questions?
So this is just a more detailed version of basically discussion one.
Yeah, you can put it like that. Absolutely. And it's going to be, like I said, it's going to be very specific, to your community and your demographics in your area. Yes, ma'am. So like with your, when you did your discussion, you picked a vulnerable group that was in your area, right? And the resources that were available. This is just a little bit more broad, right? You're going to just kind of look at the whole community. Does that help? Don't get quiet. Does that help? Does anybody else have any questions about it before we get started? No? Are y'all tired? Is it really Wednesday? It's almost over. All right. So for today, so a bunch of different readings that were for this week, right? Um, And so the concepts for week 2, um, we're, this weekly concept, so school nurse, growth and development, common childhood ailments like eczema, type 1 diabetes, lead exposure, scabies, lice, ADHD, iron deficiency anemia, scoliosis. So a bunch of different things. There was a bunch of different readings that are assigned in your PEDS book, as well as your fundamentals book, and your med surge. All right. And then there's, of course, the PowerPoint chapters in there, and there's a nice little some great information about school nurses. Has anybody ever thought about being a school nurse? No? Anybody like peds? A little bit? All right. So I have a PowerPoint. I will share my PowerPoint. And we will, again, talked about the different concepts. So we look at school. We're going to start with, we'll talk about school nursing. Um, and so school nurses, I'll share my screen. So school nurses, they have a lot on their plate. That is a huge job. Who has, how many of y'all have children? All right, so those of you who have children, have you had any interaction with their school nurse? Yep. All right, so school nurses, they are caregivers, they're educators, they're consultants, they're case managers, sorry. They're also, do community outreach. And so when we look at kids, more than almost half our kids out there have at least one chronic health condition, whether it's something like asthma, diabetes, food allergies, or even poor oral health. And so school nurses, a lot of times they're the only healthcare provider in a school. So those school nurses play a really important part in our children's lives. So they provide care for illnesses and injuries. They also can oversee self-administration of medications. In some cases, we know that they also give medications that are ordered by the, child's doctor. They provide health information about growth and development, puberty, substance abuse prevention, hand hygiene, diet, exercise, obesity prevention. They also provide health information to teachers, parents, administrators. If there's students that have complex chronic illnesses, right? The nurse may coordinate care among providers that occur during the school day. So, like some kids have like PT, OT, speech that come into the schools and work with those students. Um, and so the school nurse may be involved in that. And then, also, there's things like within the community, like health fairs, festivals. They also may coordinate with volunteers or other organizations to bring education or programs to the schools. Like, and I've seen immunization clinics that have come to the schools. Dentists in some cases too. They'll bring dentists in, and they're not obviously going to really do any dental work, right? But they can do screenings and they can identify any dental issues that may be present, right? To provide that information back to the parents. So when we look at the prevention in school, so primary prevention, we know primary is prevention, or primary prevention is, I know I said prevention, I don't know why. We're trying to, prevent disease, we're trying to prevent injuries. So, what education can we provide in the schools to prevent some of these issues? What education as a school nurse can provide?
Hygiene,
Hygiene, absolutely, hygiene, right? What else?
Would immunizations be under there?
Immunizations, right? So one of the primary prevention is immunizations, right? So encourage, you know, your child needs to be immunized in order to go to school, correct? Right? But even as far as some of those, like the HPV, the annual flu vaccine, right? Some of the ones that parents may not, think about. We look at prevention of injuries, right? We can do like, school nurses can provide information about playground safety, looking at the playground equipment and making sure that it is safe, encouraging that, they use their protective equipment. So when they're outside riding their bicycle, make sure they're wearing their helmet, they're wearing pads, even when they're playing sports. And then of course, education about substance abuse behaviors, right? Education on the effects of substance abuse, the earlier the better. Um, we start young, things, the programs like DARE that they have in school, right? Aware, and not only for the kids, but for, parents, the teachers, um, reducing the risk of disease. Again, that's your immunizations. Um, your prevention techniques, right? Teaching kids how to wash their hands, right? We all know as nurses and future nurses, right? One of the best ways to prevent the spread of disease is hand hygiene, right? So making sure kids know how to wash their hands properly. Um, Diet, exercise, lifestyle factors that can help to reduce the risk of chronic illness. Who looked at the Healthy People 2030 objectives? Yeah. Has anybody looked at the Healthy People 2030 yet? So what are some of the Healthy People 2030 objectives for kids?
Prevention of like preventable diseases and ailments.
Okay. Another big one too is obesity, right? How do we reduce obesity? And so, that's another thing that we have to look at too, is what kind of foods and things are we offering our kids within the school. In some cases, or where allowed, also, we want to provide sex education for the prevention of sexually transmitted diseases and unintended pregnancies. That is also one of the Healthy People 2030 objectives. Have to be careful though, because in a lot of states, in a lot of areas, we're not allowed to, the school nurses are not allowed to provide that education to students. However, if they are directly questioned by a student, school nurses can discuss things like contraception, the emergency contraception, things like that. So one of the big things when we're dealing with pediatrics that's different is if they come to you about their, reproductive rights, they have the right, or you have the right to answer their questions. In those cases, parental consent is not required to direct, so you can answer those questions. Biggest thing when working with peds is making sure that you're talking with them at their developmental level, right? And so using appropriate language, that kind of thing. Your secondary prevention measures, these are your screenings for early identification, treatment of the condition, right? So what are some of the common complaints in kids?
Hearing and eyesight.
Okay, hearing and eyesight. What else? Awesome. That was great. So, think about a school nurse. What are some of the things that they may hear from kids?
They complain about their stomach hurting.
Your stomach hurts, right? They have a headache. They may have cuts and bruises, rashes, itching, right? So see, these are some of the common things that we may see in a school clinic, to see some injuries, right? Some playground injuries. And so, screening for potentially chronic contagious illnesses, notifying the parents, things like that, that's going to be part of that school nurse, right? Do they have strep throat? Do they have, chicken pox? Do they have, flu, COVID, a common cold, whatever? We're also going to screen for the risk or presence of chronic illnesses, obesity, asthma, anxiety, depression, those kinds of things, ADHD, bipolar, right? A lot of kids that have ADHD, they may not have those symptoms or they may not be recognized until they get into the school system, right? And so school nurses may play a huge part in discussing that with the parents, right, as far as getting maybe testing and things like that. Of course, the vision and hearing screens. School nurses do vision and hearing screens at the beginning of the year. All right, that's part of their intake process. Um, they also may do height and weight, scoliosis screenings. Remember, I don't know if anybody remembers, like back in high school and before, you had to get your scoliosis screening done, right, at the beginning of the year. And then bullying is a huge aspect too. School nurses may play a part in that, because, if we are able to identify, or I'm sorry, identifying bullying, that bullying puts kids at risk for mental health disorders, suicide, violence towards others. And bullying is at the center of most school violences, whether it is at home, whether it's at school, whether it's in person, whether it's cyberbullying, right, through the internet, text messaging, that kind of thing. And so we want to, identify these issues early and get school administration, parents involved as early as possible, right? So that we can help prevent violence and other issues. It also helps, school nurses can help kids develop positive coping mechanisms and skills, right? That will help them as they grow into adulthood. Tertiary prevention, this is of course treating and managing an existing condition. So school nurses may be giving medications. The medication obviously has to come from a medical provider. It has to have an order and directions, right? The parents also must provide, consent for you to give that medication. So like if they're an asthmatic, a diabetic, ADHD, and the school nurses having to give those medications. Nurses also do IEPs, so the individualized education plans are part of that process as well. Again, they may coordinate, with some of those outside services like PT, OT, and speech. And, even in some cases too, when we look at mainstreaming kids that have more serious diseases like your cerebral palsy, um, cognitive delays, other physical and, physiological issues, right? They may have to coordinate those cares because those kids may be coming in with caregivers with them. And then providing education on how to manage chronic illnesses, whether it's the asthma, diabetes, whatever it is, for both parents and teachers as well as the child. And then, in the high school area, they also may work with pregnant adolescents, how to help them maintain those healthy pregnancies, a healthy school environment, right? Because the goal with our pregnant adolescents is for them to finish school, right? We want them to be able to take care of themselves. We want them to be able to take care of their child, but we also want to make sure that they finish school. So there's a lot of different things that go on with, working within the school system. It is a lot, that is placed on those school nurses, and they do care plans and everything for, not every child, but for a lot of the kids within there. So this is just, the different ages that you're going to see. Who's in pediatrics now? Is anybody in peds now? Have you guys already taken pediatrics? So some are in peds now, okay, or have taken it, okay. So, just here, prenatal is conception to birth. Infancy is birth to 18 months. Early childhood is 18 to 6 years. Middle and late childhood is 7 to 11, and adolescence is 12 to 18. And we know, depending on, we look at some of those pediatric theorists, right? The ages may vary a little bit. So common childhood ailments, asthma, eczema, type 1 diabetes, acute conjunctivitis, scabies, pediculosis capitis, um, lots of fun ones there. ADHD, iron deficiency anemia, scoliosis, and lead exposure. So let's start with asthma. What is asthma?
It's a respiratory disease.
Absolutely. It's a respiratory disease. So, with asthma, they have increased or they have a overreactive airway, right? Which, usually leads to the, inflammation in the airway, the wheezing, the shortness of breath. It's what we consider reversible bronchoconstriction in most places. In most cases. What is the most common cause of asthma?
It could be genetic.
Absolutely, can be genetic and allergic, right? So the majority of your kids that have asthma usually have some sort of an allergy that goes along with it. Um, So the key three is your, asthma, GERD, and eczema. They kind of all go hand in hand. So like kids that have eczema in infancy are going to have a higher, rate of asthma as they get older. There's also an increased risk of um, asthma in our kids that are obese. Okay, so we have to take that into consideration. It is the most common chronic illness in children. It causes a lot of missed school days as well. Poorly treated asthma leads to significant lung disease in later adulthood. So what are some potential allergies that kids may have to trigger asthma? Anybody know?
Are you saying with some
Peanut.
triggers?
Yeah. What are some triggers?
Perfumes, smoke,
Like,
heat,
mhm.
working out.
Pets.
Pet.
Pets and
Mhm.
a lot of foods too.
Yep, foods, pets, all of those things are great. Pollen. A lot of people, and I like that you said that, a lot of people don't think about heat, right? Or even extreme cold as being a potential trigger for an asthma attack. So we do have to, take that into consideration. So one of the things that we really want to worry about with our asthmatics, right, is to reduce their exposure to those allergens, right? That's going to be one of the big preventative measures that we can use for them. Asthma attacks, usually they'll, start with a dry cough. They'll have the wheezing. They may have shortness of breath or dyspnea, difficulty breathing. And so, depending on what the situation is, as the shortness of breath gets worse, they may have some other symptoms, right? Like the using those accessory muscles to breathe, the nasal flaring, the orthopnea as well. Their pulse is going to go up. Obviously, their respiratory rate is going to go up. And so what is the emergency treatment for an asthmatic or asthma attack?
Rescue inhaler,
Absolutely. A rescue inhaler. And what medication is that?
albuterol, or
Albuterol.
prednisone.
Yeah, albuterol, right? Your
Right.
short-acting beta adrenergic. Your albuterol is going to be your a rescue inhaler for somebody that is having an asthma attack. Obviously, then if we know that if the asthma attack doesn't help, they're going to have to go to the emergency room or seek medical care, right? And so that's another thing with school nurses, right? Who's heard of an asthma action plan?
My
Does any-
son has one. That's how I know so much about it. He takes
Yeah.
the Lyric twice a day, so he'll do 2 puffs at night 2 puffs in the morning, and it's supposed to prevent him from having one. And then the albuterol is for like rescue emergencies.
Awesome. Yep, absolutely. And so that asthma action plan is provided by their doctor, right? So whether it's the pediatrician, whether it's their or a specialist, whoever is providing care for that child, that asthma action plan kind of just tells the school nurse, it tells the parents like what to do based off of, their symptoms or even their peak flow meter reading, right? And so it's broken down into that red, yellow, and green so that when they, are starting to have symptoms, it's a plan to follow. Eczema is another one. This is also an immune-driven inflammatory condition of the skin. It is commonly associated with asthma and allergies, and also, could have a family history of that as well. It's an immune reaction. It causes vasodilation. It causes redness with skin changes. The skin cells break down. It causes that patchy, like redness skin, and it often itches. And anybody have eczema? No. Does your son have eczema with his asthma, or is it just his asthma?
Yes, he does have eczema. He actually did a study for Children's Hospital. They were trying to figure out why kids who have asthma have eczema as well. He gets eczema like if I use a scented lotion on him, he'll
Mhm.
break out around his neck and stuff. Um, that's something, or like if I don't moisturize him enough, he'll have a flare up. Or if
Yep.
he's been outside in the grass, he'll have a flare up. But yeah, he has asthma and eczema.
Yeah, and then they often go hand in hand. Like I said, and GERD is the other one
Mhm.
too. A lot of times too with asthma and allergy, especially when they're younger, they also tend to have GERD. So it's just interesting. But yes, they are very much correlated together. And so it could be because of foods. It could be like you were saying, going outside playing in the grass, right? It could be pollen. It could be the lotions, the detergents that people use. It could be dust. Um, and, of course, it could be because of, insect bites or even vaccinations as well. So with eczema, we often can do allergy testing. Same thing with asthmatics, right? We can do what's called patch testing, and we try to identify what they are allergic to so that either we can, help them to avoid that, or in some cases, kids will get allergy shots, which is desensitizing them to whatever they're allergic to. Um, so there's a variety of treatments, other things too. There's, emollient bath, there's, lotions and creams. There's non-steroidal creams, like my favorite is I use Cetaphil for mine, or I'll use Eucerin for my eczema. Um, and then, of course, if there's an extreme flare up, there's, steroid creams that can be provided. The biggest thing too is we want to avoid any strong soap, shampoos, even detergents and things like that. The doctor that I worked with, one of his specialties was asthma. So we saw a lot of kids with asthma and allergies and uh, eczema and things like that. And so, it's always just making sure that you're using, those real mild soaps. Like Dove is a really good one too, because it helps to moisturize the skin, and it generally doesn't have a whole lot of, not the scented Dove and all those others, like just the plain Dove, because it is generally a mild soap. So I'm going to stop sharing for this, just because as we go through these different diseases. So type 1 diabetes. What is type 1 diabetes?
Autoimmune disease in which the body produces no insulin.
All right, it's an autoimmune disease where the body doesn't produce insulin. All right, well, how does type 1 differ? What is type 2 then? What is type 2 diabetes?
Type 2
It's from your
is
diet.
Go ahead, Kevin, go ahead.
Type 2 is something that you develop. It's not primary, it's more secondary.
Okay, it's more
And you're
secondary.
insulin resistant.
Okay, so with type 2 diabetes, we could also have a reduction in our insulin production, and our cells can be resistant to the effects of the insulin that we are producing. So very good. What are the acute presenting symptoms of diabetes? Then there's 3.
Polyuria,
Polyuria, polyphagia, what she said.
Good job. Gotcha. Yeah. So we have polydipsia, we have polyuria, and we have polyphagia, right? Awesome. A lot of times too, when those sugars are really high, because that's when you're going to see those 3 symptoms, right? They're going to be lethargic. They may have some weakness. They are going to present with some weight loss as well. So with type 1 diabetes, right, that sugar can get into the cells without insulin. All right. And so the blood glucose is going to rise, and that's what causes the symptoms, right, of our diabetes. The cells will start to burn fat and protein for energy, and that's what leads to that weight loss and the onset of the acidosis that occurs, right? Hence that ketoacidosis that develops. A lot of times too with type 1 diabetes, they may have a history of like recurrent infections, which are usually fungal infections are more common in our diabetics. And an acute infection can also be a trigger for somebody to develop diabetic ketoacidosis. So what's the treatment for type 1 diabetes? What's the primary treatment for type 1 diabetes?
Insulin.
Insulin, absolutely, right? So insulin is the treatment for type 1 diabetes, and also in conjunction with diet and exercise, right? Because those things are just as important as well. So tell me, what are some things, I know a lot of our type 1 diabetics are diagnosed when they're very young. Okay. They can be diagnosed earlier, but a lot of them are diagnosed really, at a fairly young age. So with that, they kind of grow up, with diabetes. So to them, it's a norm, right? But think about, as they get into school and they're getting older, how do you think adolescents deal with diabetes, especially type 1 diabetes? How do you think that they feel?
I know they have pumps and all, but they might feel, when you mention like bullying and stuff like that, they might feel different than their peers that, don't have to deal with something like that.
Right. They may feel different. They may get bullied. They may be uncomfortable, right? They, think about being an adolescent, right? Hanging out with their friends, eating the junk food, going for pizza, right? So it's a different lifestyle, right? And so, they may, if they don't have a pump, right? Imagine, they're hanging out with their friends and then they have to go and they have to check their glucose levels. They may have to give themselves insulin injections, right? So it is something that can be very difficult for adolescents to deal with. There may be some grief, there may be some anger, like you said, feeling different, feeling like they're, not the same as some of their friends. And then they have to deal with all the restrictions that are involved with being a diabetic, right? What they can eat, what they can't eat. And so that's, where the resentment may come from. And so it's okay. They can express their anger and their grief and their resentment, right? Making sure that they have those good coping skills, teaching them appropriate coping skills is going to be key. But we also have to make sure that we are providing that education, right? So that they can still manage the disease process and try to prevent some of those long-term complications of diabetes. Because unfortunately, right, there's no cure. This is something that is going to be forever with them. And we know that with the tightest glucose control, that is going to have the best outcome to try to prevent some of those long-term complications from diabetes, right? Like the retinopathies, the nephropathies, the neuropathies, the cardiovascular issues that can occur with diabetes. So education, right? Lots of reassurance. And there are support groups, right, that they can get with other kids their age that also have diabetes that gives them, a place to maybe vent, right, even share ideas and things like that. That may be helpful for them as well. And then making sure that parents are educated. So when I worked in peds, or no, I'm sorry, not in peds, I did work with type 1 diabetics and peds. But when I was a brand new LPN, I worked in long-term care, and I worked skilled rehab. And we had a 19-year-old. Imagine being 19 years old and going into a skilled rehab facility where the majority of the majority of their patients are, 65 and older. But at 19, and I just 19, I just think about it all the time. At 19, she was diagnosed with diabetes when she was about 8 months old. At 19, she had already had an above the knee amputation. She was already blind and she was on dialysis and she was only 19. And so we would, she was there for therapy, because she had the amputation was recent. So she had come in for therapy. And then of course, to get fitted for a prosthetic and things like that. But she would go to dialysis, and of course, her parents would come and they would meet her at the facility after her dialysis treatment, and they brought her all sorts of junk food. It was fast food every day, whether it was Taco Bell, Wendy's, McDonald's, absolutely 100% non-compliant with her diet. And so didn't have really good glucose control. So we can see that, these things can those complications can develop, rather quickly and even in a young person. Unfortunately for her, she left our facility. After she left the facility, a few months later, she ended up passing away from complications due to her diabetes, which is horrible because she was so young and still had a whole life ahead of her. So this is where education, especially when they're younger with the parents, is making sure that the parents understand the disease process and that they know how to, or have resources for proper diet, especially maintaining glucose levels, giving the insulin, things like that. And like you were saying, Kevin, earlier, things like the insulin pumps and the glucose sensors have made things a little bit easier, right, for parents to, control their glucose levels or at least be alert to, the levels on a more continuous basis. All right, what is conjunctivitis?
Pink eye.
Pink eye. Oh, anybody ever had pink eye? I think pink eye is the worst. I think pink eye is the worst. So it's an inflammation of the conjunctiva, which is that, just the mucous membrane that lines your eye. It can be caused by bacteria, can be caused by a virus. It can also be caused by allergies, and irritants. All right. So some people that have really bad seasonal allergies also can develop conjunctivitis. Of course, the treatment is going to be different, right? If I have, pink eye because of allergies, right, I'm not going to require those antibiotics. I mean, just might provide some really good eye care. But it is contagious, right? Anybody that's had a kid that goes to school, knows that it is contagious. And so, your bacterial, if it's caused by bacteria, generally it starts in one eye, and if we're not careful, we know that it can spread to the other eye. The viral, the allergic, the other types of conjunctivitis generally will appear in both eyes at the same time. And so again, it is infectious. So, making sure we're doing good hand washing, avoid touching the healthy eye. One thing about conjunctivitis is it is itchy. It itches, right? So what are kids going to want to do? They're going to want to rub their eye. All right. They want rub one eye, they may rub the other. And so they can transfer that conjunctivitis from one eye to the other. It's generally treated with antibiotic eye drops, right? Once they start the antibiotic eye drops, they can return to school after 24 hours. Once we've started those eye drops, making sure that, putting the eye drops in appropriately, that parents know how to use the eye drops. Or anybody ever had to use the erythromycin cream? Oh, the erythromycin ointment is, yeah, that is not fun, especially trying to use that in kids. But remember, if we're using the ointment, you're going to put the ointment in from the inner canthus to the outer canthus, nice thin layer. Their eyes, their vision may be blurry for a little while as the medication kind of, gets disseminated throughout the eye. But again, biggest key is hand washing, making sure that they get those antibiotics on board to try to prevent it from spreading. And one of my least favorite things to talk about is, what is scabies?
Mites under your skin.
Yes. Has anybody ever seen scabies? No. Okay. So yeah, so it is a parasite that the little bugs, they burrow under the skin, they lay their eggs. And so it itches, especially at night. You may have like a vesicular rash. They may have like little eruptions. They also, you can see the lines underneath the skin. It's more likely in the folds of the skin, the soles of the feet, between the fingers and toes, but it is very itchy. It's spread by direct contact, so person to person, or by sharing bedding, clothing, towels, things like that. What's the treatment for scabies? Oh, excuse me. Anybody know? So treatment is Elidel, which is an anti-parasitic cream. There's oral ivermectin is another one. But with Elamite cream, what you do is you apply it from the neck down before bedtime. All right, so it's gonna cover their whole body. Put the cream on, go to bed, shower the next morning to remove the cream, and then it's usually repeated in 7 days. The Elamite it doesn't affect the eggs, but it will affect the living bugs. And so we repeat the process in 7 days to get rid of, those hatched eggs at that point. Um, your clothing, bedding, stuffed animals all need to be washed. Again, no sharing towels, bedding, clothes, anything like that. You want to wash them with and dry them with high heat. So like, it's same thing with like if you had a child that had lice or something like that. For like larger stuffed animals or things that cannot be laundered, you put them in plastic bags, and make sure it's sealed tight so there's no air getting in, usually about a week, and that will cause, the mites to die, and then they're good to go. Which brings us to our pediculosis capitis, which is our head lice. The louse lies near the base of the hair shaft. And so lice are like this, I don't know, like brownish black color. The white or the eggs that you would see. And so a child that has lice, you will see both the adult lice as well as the nits in the hair. They also may have like excoriation because these also itch too. So the child may, I'm going to start itching just thinking about it. It's like the worst the worst topic is like lice and scabies and stuff because I'll just start itching for no reason. But yes, and they may have some like excoriation from where they have been scratching. A lot of them will complain like that they feel stuff like on the back of the neck. And that's because maybe they can actually feel like them biting the back of their neck as well. So it is easily transmitted from one child to the next, or even from parent or adult or child to a parent, that kind of thing, through sharing combs, hats, brushes. Think about it, right? Kids are in school, especially younger ones, they're all playing in groups, they're sitting in groups, right? So it's very easily transmittable from one child to the next. So, when your school kids, your daycare kids, one thing about lice is a lot of people think that it's related to like dirty hair, or it's related to cleanliness. Lice prefer clean hair. So 100% they prefer clean hair. The natural oils in our hair actually help to prevent lice because they can't cling into those hair shafts. So it is not related to cleanliness. But actually or dirtiness or whatever you want to say, however you want to say it, because the lice actually prefer clean hair. And we do tropical treatments, and I've seen all sorts of working in peds. I had seen all sorts of different things that parents have tried, like mayonnaise was probably the one I was like, mayonnaise I never would have thought of, but that is one of like those, home remedies that parents try. But there's like, what is it? It's red. There's a bunch of different over-the-counter products that you can use to treat lice. Kids will be sent home from school, right? So, school nurse or the teacher notices that the child has lice, they will be sent home from school until they have, done the treatment. So once the treatment has been done, they can return to school. And so, that is one thing. I remember I had lice once as a kid, and I had the longest hair. So like my hair was almost down to my waist. And I remember I had one of the girls in our neighborhood. I grew up in Brooklyn. One of the girls had it, and I had gotten it from her. And I remember my mom was like, "I'm gonna have to cut your hair or shave your head." I forget what she said. It was horrible. Needless to say, she didn't shave my head, but it was still, I was like terrified that she was gonna have to shave my head. Um, but yeah, there's a variety of different treatments that are out there. One of the big things that when I was in peds that we had noticed too is a lot of the lice now are becoming resistant to some of the products that we're using too. So it may, one treatment or two treatments, they may need multiple treatments to get rid of all of it. ADHD is our next one. So ADHD is attention deficit hyperactivity disorder. And so this is where they experience symptoms of inattention, distractibility. They often have increased gross motor activity, impulsivity. A lot of times too, these kids will underperform in school. However, most of your ADHD kids are really, really smart. It's just that they have the inability to focus and to pay attention, right? So they generally don't perform as well. And they also, right, usually get some negative, attention from parents and teachers, right, and other school personnel, just because of their behaviors, which then can lead to things like low self-esteem, poor interaction with others. So what are some of the treatments that are available for kids with ADHD? What are treatments that we use for ADHD?
I know there's medications, Ritalin, Adderall, all that type of stuff. I don't know if that's the first option, but that's definitely something that a lot of people take.
So,
Children.
yep. So the process for identifying ADHD or diagnosing ADHD it's pretty extensive. So we would do, it was 6 hours of testing. Okay, so they would come in 2 hours at a time because a kid with ADHD is not going to be able to sit 6 hours through testing, and it's a bunch of different tests. And then it's scored. There's different, obviously different levels that they can be at with ADHD. Once the test or, once the scoring is done, then the parents are provided with options. Okay. So medications often are going to be first line treatment for kids with ADHD, especially depending on the severity. And there's stimulant medication, there's non-stimulant medication. One thing with ADHD, just like with any other medication, right? It's not just a one size fits all. So there's, whether they, a lot of parents want to choose the non-stimulant medication initially, right? Because they don't want their kids to be on the amphetamines, that kind of thing. So, we can always do a trial of the non-stimulants. If the non-stimulants don't work, then we will try the stimulant medications. Always start at lowest dose possible, right? We can gradually increase. Other things that are really important for kids with ADHD too is, putting them in the front of the classroom so they're front and center. Make sure that we're giving them really short, clear directions. Repeating them often. You don't want to just shout off a list of things to do, right? You want to give them like one or two tasks and reinforce and then continue from there. Do not limit outdoor physical activity. So one thing, like, I don't know how they do it in schools anymore. My kids are older, but I remember, even with working with some of the other kids, like they got in trouble, in class, right? Then the teachers wouldn't let them to go outside for recess, right? Kids that have ADHD, they have a whole lot of pent up energy, right? So recess is actually really good for them, right? That helps them to run around, and get some of that energy out. So restricting their recess should not be a punishment for those kids. They may also benefit from additional tutoring as well as behavioral counseling. So cognitive behavioral therapy, also, and family therapy is also important for kids with ADHD. For one with the kids, they, may be able to learn how to control some of their impulsiveness, also develop some coping skills. And ADHD can be very, exhausting on a parent as well. And so having the parent as part of the as part of the counseling and the training also is beneficial. So it gives the parents some coping skills as well as some parenting skills in dealing with their child that has ADHD. And then we have iron deficiency anemia. Um, Iron deficiency anemia is more common in infancy and adolescence. And this is generally, well, in infancy, it's related to growth spurts. In adolescence, especially adolescent females, right? It is related to menstruation. And so, we have to be, we have to think about that and when, that health education, what we're doing with our adolescent females. And so how do we, we need to find ways to increase their iron in their foods. So myplate.gov. I don't know if anybody's ever been to that website. It's an awesome website, as to help with parents, help parents or even you, me, whoever, in planning meals. And it'll, show some of those, more important, especially with like kids that have IDA or iron deficiency anemia, how to increase iron in their diet. So what are some foods that are high in iron?
Beets, liver, molasses.
Liver molasses, okay. Anybody like liver? Me neither. I love the smell. Oh my gosh, when I smell liver and onions cooking, I love the smell. I just can't, the texture, I can't do it. Red meats, egg yolks, your dark green leafy vegetables, dried fruits, dried beans, especially, when we look at kids, like, our infants and young children, most of our foods are iron fortified, so they get that iron that way as well. If the IDA is, if they are extremely low or extremely deficient, we can add iron supplementation as well. Vitamin C containing fruits and vegetable or fruits and fruit juices also help to increase iron absorption. So that's something that, teaching our parents about diet is teaching them that. Even if they have to take iron supplementation, right, giving it with a vitamin C source, mostly orange juice. Not too many people like grapefruit juice, right? But give it with some orange juice. Long-standing iron deficiency anemia can retard growth. It can also hinder, um, I saw that, yes, it can hinder cognitive development. I saw that they do have the beef liver capsules. I've also seen, I'm not sure how I feel about this. They also have placenta pills that people can take as well. I don't know. I don't know how I feel about that. I really don't know how I feel about that. Um,
Yeah, I'm scared to eat beef liver, like cook it and eat it. So I think I'm gonna try like the capsules.
yeah. Like I said, so growing up, a very strong Catholic family. So it was always fish on Friday and liver on Sunday. And like I said, it smelled so good. Even to this day, I love the smell of liver and onions cooking. I'm like, oh, it's a comforting smell. And you still can't eat it. I still can't eat it. One of the offices that I worked in, I worked for an insurance company. They had gone to, I think, Piccadilly, and they had gotten liver and onions, and it just smelled so good. And so she was like, "Do you want to try it?" I'm like, "No, I don't like it." She goes, "No, try it." And yeah, I took a bite. Nope, still don't like it. Love the smell, still can't eat it. I used to my aunt and uncle used to get, or my aunt so much, she used to get so mad at me because I would literally dump like a half a bottle of ketchup on my liver just to get it down, because you weren't allowed to leave the table until you finished your food. So I would make liver soup with ketchup just to try to get it down. Yeah, I can't. I don't know. Nope, can't do it. Can't do it. All right, two more, and we're almost done. So, then we have scoliosis, and scoliosis is that S-shaped curvature of the spine. So again, I don't know if you remember, like in, elementary school, high school, this is where you had to, go in front of the school nurse, you had to bend over, and basically we were looking at that spine, to see if it's, any kind of deviations or any kind of S curvature of that spine. um some kids are done, I've actually talked to students, it's interesting, just in conversations in class, they're like, yeah, she was like, didn't know I had scoliosis, but school nurse, found it when I did my scoliosis screening. So I was like, that's interesting to know. um And the symptoms of scoliosis generally will, develop pretty slow. They're typically not painful, but you may see things like one shoulder may be higher than the other. One of the scapula may be more prominent than the other. Um, I'm trying to think of what else. One arm may appear longer than the other, especially when they're bending forward. They also have some like hip issues as well. Again, and most, the healthcare providers too, when you go in for your physicals, they also will do scoliosis screening. And there's a variety of different treatments for scoliosis, that it just really depends on the severity. So there's like things like braces. There's also surgical options depending again on the severity. But with the severity of the scoliosis too, it's not just about the back, right? It can affect breathing, it can affect posture, the ability to, play sports and do other activities as well. Not mild, right? Again, there's different levels. And so the treatment options that are available are going to depend on the level of the scoliosis. And then the last part of it, the last one of these is going to be lead exposure. And so lead, that was present in paint prior to 1978. So when we look at risk factors for kids and lead poisoning, we look at homes that were built prior to 1978. As the paint chips away, the chips are inhaled or they are orally consumed. So say that, think about little kids, the lead dust or the paint chips, on windowsills and things like that, or even in some cases in prior to, I forget what year, but like in cribs and things like that, the lead dust, the lead chips, or the lead in the paint chips, however I want to say that. Apparently, and I don't know this for fact, this is just what I was, when I would talk to the provider about it, it tastes sweet. And so because it has a sweet taste, right, they're going to want to consume more of it. And so that is, generally it's either inhaled or it is orally consumed. So that's how the lead gets into the body. There was lead in plumbing. So some of the pipes in some of the older homes had lead in there too. And so the lead would get into the water. And of course, then the water is consumed, right, by the child or the adult, which can increase the levels of lead in the body as well. Even sometimes, lead in the soil can occur as well. And so, now, so our biggest, we started our lead screenings when kids were 9 months old. And that was when we would do the first lead screening. Lead levels are declining, which is nice in the US. So the lead levels are declining. And so, they may get that one lead level at 9 months old and never get another one. And we'll use screening, a screening questionnaire. A lot of it is like, how old is your home, that kind of thing, to, just identify what their risk is. Other areas where, some of the toys that have been imported from other countries may have lead in them as well, which has, also contributed to it. But the treatment for the lead exposure, the lead level is depending on how high the lead level is. So obviously, right, we want to remove any exposure that the child has to lead. So again, it's mostly in your older homes. The newer homes that were built after 1978 do not have the lead-based paint in them. And then, if lead is an issue, then it does need to be removed. And so there is a variety of ways that can be removed. But it should be done professionally because PPE will be involved, lots of sanding to get rid of the lead paint. And of course, you don't want to be, you don't want the child, you don't want to be around any of that dust and debris as that removal is happening. And then if the level is high enough, we can do what's called chelation therapy. And chelation therapy just helps to remove the metal from the body. And so we don't generally do that until the lead levels are significantly high. But it, they could, some of the symptoms that these kids could experience would be inattentiveness, hyperactivity, disorganization, right? It almost sounds like they have ADHD. They also headaches, abdominal pain, constipation, clumsiness, agitation. It could eventually lead to stupor and as well as convulsions, depending on how high those lead levels get. So this is something that, needs to be, this is why we do the screening, to ensure that they are getting, the appropriate treatment should they need to have the, treatment related to, the lead exposure. And then I'm going to share my screen and we'll go through this last part. The last part is family nursing. And so if you've taken peds, you've taken OB, you've heard about family nursing before. But family is a group of individuals, right, who care about and for each other. And so some of the functions of the family, financial, right? Planning for the future, making good financial decisions, health, teaching those healthy behaviors, teaching health maintenances, informal caregiving, reproduction is another one, right? Just the continuation of the species, provides for socialization, right? Because when babies are born, who's the first people that they socialize with, right? Their parents, their siblings, other members of the family. So, right. So that's where, that proper interaction, how, raising kids to fit into society, to become productive, responsible, right? Well-adjusted adults, all those wonderful things that we as parents hope to provide for our kids. Effective as well, creating a sense of identity, right, and belonging through affection, through love, through spending time together, bonding activities, all of that stuff, support, recreation, right? These are all, parts of, the functions of a family. And so, if there's any, failure to meet any of those, that can lead to dysfunction, it can lead to, strife, it can lead to crises within the family. It's, when we look at contributing factors for future substance abuse, anxiety, depression, unsafe sex practice, those are all be usually the result of just some sort of a dysfunctional family setting. Right. So think about it, right? Family, you're born into your family, right? They're your first support. They're your social support system. They're your safety net, right? And so you think about peds and you think of Eric Erickson, right? And his stages of psychosocial development, right? Trust versus mistrust, right? That within that first year of life is so important. Um, and so health risk with family, disease develops in response to the three contributing factors, which are your genetic, your environmental, as well as your lifestyle and your behavior, right? So genetics, right? What's our predisposition, right? So, unfortunately, we're all born with certain predispositions. But a lot of the diseases and majority of diseases is not caused directly by our genes, right? There's usually some sort of an environmental or even behavioral exposure that is going to increase our risk, right? That's why they're considered risk factors, right? And the more risk factors that you have, the more likely that you're going to develop a disease. Environment. This is your physical environment, your social, your political environment, right? So where we live, right? So when you're doing your vulnerable populations project, right, in your windshield version, or your windshield survey, think about, the areas. Is it a high crime area? Is there lots of pollution? What are the living conditions? Is it a high stress environment, right? So think big city to more rural areas. Um, are there, and with the family too, is there an adequate financial resources, social resources, emotional resources, and then behavioral. So diet is probably one of the biggest things, especially, since we hear about it so much, especially here in the United States, right? Our diets are very high in sodium. We have lots of high saturated fats, sugars. And so this, as well as high inflammatory. And so this contributes to chronic inflammatory conditions like then diabetes and hypertension, heart failure, arthritis, osteoporosis, all of that, right? And so proper education is diet, right? So high, large amount of vegetables, fruits, whole grains, eating more seafood than red meats, right? Trying to avoid those processed grains as well as any processed foods. And then, of course, you want to add exercise. Exercise is also very important in those situations. Other lifestyle, right? Limiting alcohol, not smoking. Of course, avoiding all those illegal drugs as well, or illicit drugs. Um, what are some things that we can do as well to, when we're looking at violence and abuse, what are some, those primary prevention measures that we can do to prevent abuse? Kids that witness abuse or are victims of abuse, as a child often, are at risk for, future violence, abuse, substance abuse, mental health disorders, as well as chronic physical illnesses. So we need to take that into consideration. Um, what else with behavioral? Um, Injuries and accidents are common causes of preventable injury and death in children. Falls, fires, drownings, suffocations, poisonings, sports accidents, recreational vehicle accidents. So these are all things that, when we're looking at family health risks that we need to take into consideration. And so as a nurse, one of our goals is education and providing, that information, right, to prevent disease and illness as well as injury. And so, depending on the and developmental level of the child or even the adult, right, there's still education and treatment, or there's still education that we need to provide for adults as well, to prevent, or try to prevent certain disease processes from occurring. Um, so, all right, 1 minute to spare. Does anybody have any questions?
I have a question. It might be kind of redundant, but is there a reason why this class doesn't have like a textbook?
So the this is it's kind of like all the subjects kind of into one and related to community. So that's why there's excerpts from different your other textbooks. Yeah, so that's why you'll have reading from Med-Surg, you'll have readings from Peds, OB, foundations, right? So it's kind of spread out throughout all the courses, and so we kind of just came in with one class taking all that information. I know the readings are scattered. Trying to make it
So,
as simple as possible.
then she asked, I guess, following off of her question, like, I'm trying to understand how to really like tackle the curriculum for this class, being that there's a mix. It seems like my mind's on a constant on and off switch between the definition of community as a whole and then individual base, like of peds and the different conditions we might be covering. So I don't know if like there's some other way, you know.
S-
I
okay.
I just I'm lost in my head.
Okay, so we are talking about individual, like for this week, right? We're talking about different disease processes. We're talking about family-centered care. We talked about the school nurse, right? We talked about lead exposure. And so those are our concepts that are pretty broad, right? But those are very common, um, those illnesses or diseases are widespread, right? It's not just in one child. A lot of the times you're going to see there's going to be the groups of them that are going to have that, so you can focus it on a group rather than just an individual person. And so we're, big thing to think about is to use your yes. Class is over. If you need to leave, you can leave. Yeah, absolutely.